This is the third in a series of training videos about the business of the eyecare service. Module 3: Human Resources in the Eyecare Service. The learning objectives for this module are to know which people should be involved in the service, to understand the roles of each person, and to recognise the need for specific training for these roles. A very high level of coordination and communication is vital between the people working within the service. Regular meetings with eyecare staff are invaluable. They also make planning and reporting easier. The purpose of each meeting is to report the details of recent work at the Vision Centre and/or on outreach, and outline the coming estimated workload. It is essential to discuss factors that influenced successes and failures. There should be a template form for everything that needs to be communicated on a regular basis, especially for statistics. The eyecare service is also responsible for liaison with the community, government, and NGO agencies for planning, reporting, and funding purposes. When considering human resources for outreach, success of the event depends on an effective organiser from a well-organised eye department, a committed community health worker, and an adequate number of clinical personnel and volunteers. This number is determined ahead of time based on the number of outpatients expected at the event. The organiser's main responsibilities include contacting and advising community health workers, conducting the outreach event, and keeping stakeholders up to date on outreach arrangements. One important aspect of being an eyecare worker is to be able and take the time to counsel patients about their eyes and eyesight. There are 3 reasons for counselling patients. Firstly, it improves patient comfort and satisfaction. Secondly, it increases the uptake of glasses and other treatments that you might recommend. And thirdly, it serves the purpose of providing an eye health education. The productivity of the eyecare service, number of glasses and acceptance of referrals, is highly dependent upon the eyecare worker's communication skills. It is essential to answer the patient's questions and convince the patient to follow the advice being given. By way of a checklist, the following counselling behaviours should be aimed for. Respond to any concerns or questions that the patient may have about medications or glasses prescribed. Convince the patient to accept the glasses prescribed by explaining the benefits and also the consequences of not wearing glasses. Counsel patients who have systemic problems, like hypertension or diabetes, to seek further medical advice. and counsel patients to come to hospital if they require any specialty treatment. Detailed counselling focuses on details of the diagnosis you are giving the patient, the cause of blindness or other visual impairment that they may have, any treatment advised, the need for surgery in cases of advanced cataract, details of the treatment or surgery to be expected at the base hospital, and the opportunity for health education on primary eye care. Now we will look at some of the clinical benefits that arise from working at outreach events. Outreach events offer a large number and variety of eye diseases that might not be seen in the vision centre setting. Outreach builds experience, confidence, and diagnostic problem-solving skills. It also increases the volume of patients that eye care workers get comfortable with seeing on a daily basis, and it helps develop the capacity to screen large numbers of patients, which is beneficial to the service and to the community. When considering our communication skills with patients, we should be aware of potential communication barriers, such as fear or a lack of self-confidence. They may see you as an authority figure, and that can make them feel uncomfortable. Different social customs to the ones you are used to. Their level of education may be a factor. Perhaps they speak a different language or dialect to you. Or possibly they are hindered by physical pain or other impairments, such as with their sight or their hearing. And it is essential that we are able to demonstrate empathy. We do this by placing ourselves in the patient's situation, by understanding their point of view and their emotions, by actively listening to their answers to our questions and what they have to say, by concentrating on them and giving them our full attention, by demonstrating patience and seeking clarification as needed, and seeking further information by asking probing questions. Furthermore, we must acknowledge and respond to the patient's words by paraphrasing and summarising. We could also change over to the language understood by the listener where possible. We should speak simply and clearly without too many technical words. We must always speak respectfully without condescension irrelevant of the patient's status. And it is extremely helpful if we respect different learning styles when asking patients to remember something. For example, repeating or writing instructions, or demonstrating, and using illustrations as needed. With regard to attitude and values amongst Vision Centre staff, each and every member of staff represents the face of the eye care institution in the community and should therefore be steeped in the values of the institution. It is important that your eye care team discuss, decide, and live up to the values of your institution. One way to think of values is to define the behaviours and standards that your eyecare institution will maintain despite any external circumstances that puts them under pressure. For example, you may decide that you will always put the care of your patient first, even if there are other things that are distracting you at that time. So, what are the standards you are aiming for? What behaviours or activities will you find unacceptable from yourself and each other and the institution in general? Don't forget, many of the most successful eyecare institutions view their communities as full partners in their work, not just supporters of it. You must set and maintain high values as you interact and engage with the community to reflect this attitude. When considering the skills required around outreach for members of the eyecare team, it is important that you are able to estimate the magnitude of blindness, the annual workload, and the unmet need in a given service area. You should also be able to demonstrate target setting techniques, to designing outreach programs to meet those targets, develop strategies and plans to achieve the goal, and apply the concepts of social and service marketing. You should also recognise the importance of community participation in eyecare services. Furthermore, you should realise the importance of health communication and behaviour change for tackling the barriers to service utilisation, along with how to use human resources most effectively in outreach programmes. For example, how patient counselling can increase the acceptance of treatment and help an outreach team to cope with the large volume of patients, and how the proper ratio of clinical to non clinical staff leads to increased efficiency. Still on the topic of outreach skills and understanding, we should be able to plan logistics for efficient management of community outreach activities, to implement quality assurance in services that we deliver, create performance indicators for monitoring eyecare services, be able to evaluate performance and to do so, and be able to identify and document case studies of successes in your eyecare service delivery. Field workers, which of course in many cases can be volunteers, benefit from learning certain aspects about eye care. These include how to measure visual acuity, what happens during an eye examination, what are the most common treatable eye diseases, such as conjunctivitis, mild trauma, watery eyes, etc., the preventable causes of blindness in their area, the treatable causes of blindness, which could be cataract or trichiasis from trachoma or other conditions, and perhaps to be able to identify eye diseases that need referred for further examination and treatment. And finally, Outreach teams must comprise the appropriate matrix of personnel to ensure cost effectiveness and high quality. For example, you may have an ophthalmic nurse or cataract surgeon or ophthalmologist if available for diagnosis and treatment of presenting eye diseases. You may have an optometric technician or optometrist for refractions, and an optometric technician or optometrist for dispensing of glasses. You need an outreach organizer for overall management of the event. And you almost certainly would rely on the help of local volunteers. That concludes Module 3 on the human resources of the eyecare service. Coming next is Module 4 on marketing the eyecare service.